Well, thank you so much, Leanne, and thanks so much to our guest, Mthandazo Ndlovu, Democracy and Governance Program Manager at OXFAM SA, and Dr. Phionah Atuhebwe from the World Health Organization, their regional office for Africa, for staying with us. I really appreciate your time. Mthandazo, I want to come to you about how COVID-19 has just further exposed also, we spoke about earlier the underfunded systems, healthcare systems, and also just the lack of access to resources for so many of the African nations. So speaking to what we were discussing before we had to take that break with Dr. Atuhebwe, what is your take on how African countries have had to get loans in order to access at least some of the relief that they seek to address this pandemic?
Great, thanks. Thank you so much, Sakina. I think one of the greatest challenges that we have kind of experienced during the pandemic now is the re-emergence of the monopolies, but more so in the name of private-public partnerships. And we know that in most cases, private partnerships do benefit the private sector because various governments have less capabilities to negotiate and bargain for public goods that will benefit the wider population. And of course, in this instance, we see that the distribution patterns and the capabilities of manufacturing are all residing with the private sector entities. And in most cases, we see that the governments are really failing to preside over and ensure that vaccine manufacturing and rollout benefits the greater population. And of course, as I've just alluded earlier on, that during this pandemic, we've seen more billionaires and more so in most recent times, their wealth has grown by over 32 billion, and that's just favoring nine richest billionaires working in the pharmaceutical sector. So much more needs to be done to mobilize resources to be invested in the public healthcare systems, but ensuring that there are also other safeguards that really ensure that profiteering doesn't happen. And what we have gone through is what one could classify as a collective failure by world leaders, including those in the private sector, because they're just interested in profit as compared to saving lives. Yeah.
But what are the answers? Because from what you've just mentioned, yes, the inequalities, the injustices have always been there, but of course exacerbated once again by this particular global pandemic. But when you are on the ground and speaking to people and just getting a sense of how they feel about the response, first at local level and then further up to the point where you get to your multilateral level, how are people responding? What are they saying? Because the one thing that COVID has done is that it has overnight exacerbated those inequalities and injustices, so that there is perhaps no country in the world that has not seen an increase in those levels because of this pandemic.
Yeah, I think certainly there has to be ways and mechanisms where, as Africa, we pull resources together and invest in community healthcare systems so that we ensure that we are resilient now and in the future. And based on reality and people's own lived experiences, you see the inequalities between the public and the private. Those who have got access remain privileged, whereas the majority remain outside the system. So I think going forward, there could be better ways of pulling together resources from some of the multilateral agencies that are of African origin. I mean, DBSA, African Development Bank, AFREXIM, and others. I think they are there to really provide financing for development. But of course, the participation of people is quite critical. We need to ensure that we invest in research capabilities, in manufacturing capabilities, do away with monopolies and do away with patent rights, particularly in times of emergencies of global concern, such as this current coronavirus pandemic. And of course, ensuring that vaccines are widely produced and distributed freely to humanity. If at a cost, it should be at a fair cost, not at an exorbitant cost that would only favor the profit and the private monopolies. And really ensure that the governments do participate equally at a multilateral level. But significant, I think, to emphasize is the need to invest in our public healthcare systems in an open and transparent way, and ensure that there is accountability across the value chain, be it of procurements. As is, Africa still doesn't have the capacity to manufacture and distribute vaccines, and that's an indictment. It is quite unjust and a collective failure. It's not yet too uhuru for Africans.
And just as we wrap this up, Dr. Atuhebwe, are there still any African countries that haven't yet had a single person vaccinated?
Yes, we do have those. We have 5 of those. So we have the Republic of Tanzania, the United Republic of Tanzania, that just last week gave us the good news that they are interested in joining the COVAX facility. We know the country right now is putting in place everything they can to also join the global efforts to combat the COVID-19 pandemic. So they will be making an application to the COVAX facility soon. And then we have Burundi and Eritrea. These have not joined the COVAX facility and have not shown any interest in vaccinating the populations. WHO, Gavi, World Bank, UNICEF, everybody, we are advocating at the highest level possible for these countries to take up the vaccine. Then we have Central African Republic and Chad and Burkina Faso. Chad was offered the AstraZeneca doses, but opted to say that they will not be able to take up AstraZeneca and are waiting for the Pfizer vaccine, which should be shipped to them very soon from the COVAX facility. Then we have Burkina Faso. Burkina Faso too took quite a bit of time before signing off some of the papers that were required for the COVAX facility and the manufacturers, but we are also waiting to ship doses to Burkina Faso. So Burkina Faso and Chad are part of the COVAX facility, but doses are yet to arrive in the countries.
Interesting. So Chad, do other countries also have a choice as to which vaccines they want to receive from the COVAX facility?
The COVAX facility just at the end of last week wrote to all member states and participants asking them if they would like to make choices of the vaccines that they want to have, or they would be open to getting any vaccine that would be available to them. So they've been given that choice to make. But also we have countries that we call self-financing countries. We have countries in the COVAX facility that are receiving their doses 100% free. So there are countries that are self-financing, like South Africa, that are paying a part of for their doses through the COVAX facility. So some of these countries are given options to choose the vaccine that they want to have. But many of them went with the option of, because we know there's a global supply shortage, give us whatever vaccine is available. So countries, yes, have now been given a choice to select a vaccine or say, give us what is available.
Well, we'll have to leave it there, unfortunately. Mthandazo Ndlovu, Democracy and Governance Program Manager at OXFAM SA, and Dr. Phionah Atuhebwe, Regional New Vaccines Introduction Medical Officer at the World Health Organization's Regional Office for Africa, talking to us there about the state of African continent's healthcare and the lack of the COVID-19 vaccine distribution in some areas. And as Dr. Atuhebwe said, 5 African nation states still haven't vaccinated a single person. So that's where we leave it there. And it's time now for a weather update as we're standing by with that.